Hello everyone and welcome to Pride Action TV. My name is Kim Hunt and I'm the Executive Director of Pride Action Tank, which is a project of the AIDS Foundation of Chicago. We also refer to Pride Action Tank as PAT because we break everything down to an acronym, and AIDS Foundation of Chicago is AFC. But PAT is a project incubator and think tank focused on improving outcomes and opportunities for LGBTQ people. And one of the things we're going to talk about today is the federal health care law, or the bill that the Republican Congress is putting forth both in the House and the Senate, and let you know a little bit about what's happening, a little bit about its history, and also what you can do. So our guest today is one of my colleagues at AFC, Elena Kennedy, who is the Manager of Health Equity at AIDS Foundation of Chicago. And how long have you been at AFC now?
Almost a year now.
Almost a year. Time is flying because it's been a busy year.
Very busy.
Between
very
state
busy.
and federal level, it's been crazy. So before we delve into the questions, why don't you just tell us a little bit about your background? What were you doing before AFC, and what do you do as Manager of Health Equity?
Of course. So welcome, and first of all, thank you so much for having me here. I am very excited to be talking about all things healthcare. I feel like I haven't talked about much outside of that, actually, for the past year. Post-election, we've been very, very busy, and, you know, we always talk about the summer recess. Well, that really hasn't come to fruition.
What's a recess?
Yeah, exactly. Summer break no longer exists. Prior, though, to working at AFC, or the AIDS Foundation of Chicago, I was in Springfield and I was doing state policy work. I was working for the Illinois House of Representatives, and I was looking at legislative healthcare reform as well as doing the budgetary work. Prior to that, I was also working in various other nonprofits, and I went to Michigan State University, so go green. And I learned bioethics and healthcare disparities, which looked at how society influences healthcare and how healthcare influences society. So I use all of that experience here at AFC.
I did not know that.
Yeah.
See, the things you learn when you bring someone on your television show. So let's get down to this bill. A lot of people may be confused, what's going on?
Right.
Can you give us a little bit about the history of this process with the health care bill?
Right. So there has been discussions historically from the Republicans about their hatred for the Affordable Care Act, also known as Obamacare, or moving forward we'll call it the ACA today. So they have run onto platforms over and over again about how they were going to dismantle, repeal, replace, repeal, destroy, any variation of that. And post-election, we are seeing that actually happen in some sense. It has been a long battle for them and has continued and will continue to be a battle for them. In March, end of March, the House tried putting through a bill, and Paul Ryan, Speaker of the House, Paul Ryan, said, never mind, we're going to pause. Fast forward to May, and they ended up pushing through a bill. It had only Republican support. Not all Republicans voted for it, but only Republicans supported the bill. This was not a bipartisan bill.
So I want to pause you on that because that gap between Paul Ryan not being able to push the bill through, and when it did go through, there was a lot that happened that allowed that bill to stagnate for a little bit. And it had to do with what folks like yourself and others were doing on the ground. So let's talk a little bit about that, just so that people know that they do have some agency and some impact on what happens with these bills.
Definitely. So I'm actually going to pause a little bit to that as well and say it wasn't so much anything that I was doing, but all the great work that was happening in the grassroots, what was happening with people like you who are watching today who got involved and got activated. I think the election showed a lot of people that they need to stay involved on both sides of the aisle, and they need to get activated and a part of their community, and that was really shown. People were coming out to town halls, forcefully requesting
Yes.
at times, that their representative was held accountable and represented the people. And I think that really showed and slowed down the process for the House to actually pass a bill. That's why they've also had to do it behind closed doors, and we can speak more of that later.
Yes, yes. So I had you pause, so go ahead and finish the...
Well, so fast forwarding, it moves to the Senate, and at the end of June, Senator and Majority Leader Mitch McConnell was about to have the bill come to a vote. And unfortunately for them, but fortunately for a lot of the health of people across the nation, that did not happen. And now they're having discussions once again about bringing the bill back to the floor. But we should note one thing, it's all happening behind closed doors.
Yeah.
There is not transparency. As we have continued to talk about as what are norms, what are laws, is this normal, or are we just freaking out about something? This is something I want to point out, that this is not normal. The speed at which this is happening, the process is also not normal. There's not transparency, there's not public discourse about this as much as we think. We've been hearing about it nonstop. It's all happening behind closed doors. And a lot of the Republicans are not involved in this process, which is also problematic.
Which is very interesting. When you mentioned that a lot of this is happening behind closed doors, it's not even just a matter of the American electorate or individuals not knowing what's happening. There are other members of the Senate who don't know what's happening.
Their own caucus is very much kept out of the conversation, which is problematic. And then when you double down and say, well, none of the Democrats are also being involved, you have a recipe for disaster, in my opinion.
So that's a little bit about the process and history that's happened. So let's now talk about what's in the bill. What are some of the key takeaways from the bill as it is now?
As it stands right now, this bill will take away health care coverage for 22 million Americans. Huge. It will also cap and cut Medicaid by $772 billion with a B, which is fairly significant. It will also increase people's premiums by about 74% by 2020. Which at 2020, there's also conveniently an election happening around that time.
Presidential election.
And that is very purposeful, just to note. And then it will also undermine consumer protections across the board. Now, today as we move forward, Kim, we'll probably be talking mostly about private insurance or Medicaid, but for all of you who have employer insurance, I want to pause, say don't turn off just yet, because 54% of Illinoisans have employer insurance. Now, this is problematic if consumer protections are taken away, because it will remove annual and lifetime limits and caps from that consumer protection component. So it's estimated actually that 1.2 million Illinoisans will reach their annual cap or limit that year. 1.2 million people already reached that. And about 900,000 will end up reaching their lifetime limit, which means their employers will make them pay significantly more for their insurance, which is exceptionally problematic. So this discussion today and the repeal of the ACA affects all people across the spectrum.
Wow, wow, wow. And speaking of the spectrum, let's just take a little slice there of those impacted. And let's talk about what this means for LGBTQ people.
I'm glad you asked. So, as part of that 22 million who would lose coverage, that also includes the LGBTQ community. And this will specifically have a huge impact on low to middle income people within the LGBTQ community. Insurance coverage increased by about 35% because of the ACA for LGBTQ community, which is massive and far exceeds actually the general population. So a rollback on the ACA also means a rollback on healthcare coverage for the community. It is also, because of that coverage, health disparities that affect the LGBTQ community, such as HIV, will also greatly be impacted. And a final thing to note is they will lose out on the benefits because of consumer protections, because of anti-discrimination laws. They cannot be directly targeted as a result. So take all that away, and this is very problematic.
Yeah, and I would suspect that a lot of that increased coverage has to do with Medicaid expansion.
Yes.
Because I think a lot of people have this notion of the LGBTQ community of being fairly affluent because they think of white gay men, all of whom are not affluent, but you know, that's kind of the narrative in people's heads around the community, but LGBTQ people are disproportionately poor compared to the rest of society. And when you look at female-headed households or lesbian couples, they are often the ones with children in the LGBTQ community, and so the poverty is even higher among that particular group. And then when you look at transgender people, the number of folks who are living on $10,000 a year is astounding compared to the general population. So for folks who think that healthcare is not an LGBTQ issue, that notion should go right out the window because it is a hugely important issue for this community.
Definitely, and the numbers of how many will be impacted are still out there. You know, this is a newer bill, but quickly looking at some of the data and research, a lot of institutions are noting that about 1 million people within the LGBTQ community will lose coverage.
Wow.
And if it's not directly losing coverage, it's those consumer protection benefits that have benefited those people or those families that will also be impacted.
Yeah, and you mentioned anti-discrimination laws. A significant number of LGBTQ people live in states where it is illegal, where it's legal to be fired if you're based on sexual orientation and or gender identity. So the protections that were added to the to Obamacare, I'll call it that, really helped folks get access to many resources and kind of in some ways help level the playing field a little bit, is particularly in those states where anti-discrimination laws are not on the books yet.
Definitely, definitely. And also a big thing is with discrimination is transgender community has also greatly benefited, and there's a large fear, and it's warranted, that a lot of people who are transgender will lose out on coverage and care and quality of care as well. Prior to the Affordable Care Act, or the ACA, or Obamacare, however you want to phrase it, a lot, and disproportionately, a lot of people who are transgender did not have insurance. And there was an uninsured rate of at least, the estimates are about 60%.
Wow.
That's that's significant. And what we've also seen, though, is that there has been a dramatic decrease. And research is showing that this year, it has decreased to 25%.
Wow.
If you're looking at policies that have had a large impact, decreasing uninsured rates from 60 to 25%, I would say that's fairly impactful.
That's impactful. And also ACA included gender affirming care too.
Definitely.
And, yeah.
So you hear about that gender affirming care, and that's so vital too for the health of people as well, to feel and to know that who they are is not just heard but respected as well by their doctor. What is also so vital, and specifically in Illinois, I just want to make sure I get this, so because of the removed discrimination transgender exclusions, some other components of healthcare have been included, and that also includes the transition-related care can also be covered. And in Illinois specifically, there is no insurance company that is allowed to have no component of transition-related care. Now, I pause, and I know that it is not perfect, and I know there is a lot of work to be done. However, this has been a huge step, And I would like to continue to see those steps happening.
Move in the right direction.
Right.
Yeah, and as you know, we had this summit, Out Aging, which was focused on LGBTQ older adults, because you spoke at the summit.
And you put on an amazing summit. That was fantastic.
Well, healthcare was one of those issues that came up quite a bit, and particularly around cultural competency, which is also a big piece of the ACA right now. Actually, we just went through the notes very recently from all of the sessions, and there were a lot of comments about cultural competency for healthcare providers and also, other service providers as well. And then just access to care and knowing what options are available to folks is also extremely important and confusing for people right now.
Definitely. I think that's why having these conversations and staying involved is so vital. I know that there has been a lot, and every day my phone, which I keep by my side at all times, is blowing up with news alerts, breaking news, action, and it can have a fatiguing effect on us. But we must stay ever vigilant and involved as best we can. Yes, we, for self-preservation, need to pull back once in a while, but having these conversations are important because these do affect us and impact maybe not just us directly, but our family, grandma and grandpa, our community at large, and that's so important.
Yeah. So, moving through this, talking about some of the takeaways from the bill and then the history of just this move to repeal and replace with something.
Maybe.
And the discussion was just repeal at one time. So.
Well, Trump did recently tweet out maybe repeal and delay, which we're still having those conversations.
Well, I remember he said healthcare was complicated not long ago. So.
Who knew?
He's getting there. So, with all of this in mind, is there any way to fix this bill?
So, great question. Great question. I think that a lot of people were upset with the ACA, and a lot of people have been upset with Obamacare. I think what a lot of people, sometimes myself included, forget is that healthcare was not perfect prior to the ACA. There were a lot of things that were wrong with it, and the ACA was its first attempt at fixing that. Historically, we've had a lot of problems starting in the 1900s trying to fix our healthcare system. The ACA was one of the most impactful and first steps since 1965 where Medicaid was pushed through.
Which also required a lot of pushing.
A lot of pushing, and we're still having that pushback now today. So, if by 1965 we're still having pushback on Medicaid, we're still going to have some pushback on the ACA. And I think what we need to see is that this was the first step, and conversations that we are having currently do not push us and drive us in the right direction to where our next step needs to be. I think we all acknowledge that there were things that needed to be improved upon, but the discussions that are being had right now are not those discussions that will move us in the right direction to a healthier community. So to go back to your question, do I think it can be fixed? I'm going to say no. And the Republicans in Congress, they know this. That's why they're having everything behind closed doors. That's why
why they've had to delay the votes.
Exactly.
Both in the House and the Senate.
Exactly. 17% of Americans don't support this bill. That's fairly telling, in my opinion. But you be the judge. So, no, I don't think it can be fixed. Senator Mitch McConnell is having conversations with moderate Republicans to do Band-Aid fixes and not look at the whole person, looking at maybe let's do this little thing, let's do this little thing. And he's also talking to conservative Republicans who want to destroy the healthcare marketplace and destabilize it. We also have a presidential administration who at every turn has tried to destabilize the marketplace through rules and executive orders. And I know this because I have to analyze all of them. So I've gone through those
I've
pages.
seen you step away to do that.
There's been many a times where I'm going home with large folders reading these. But at every turn, under the guise of trying to say, we are trying to stabilize the market, the one thing that insurance companies don't like is uncertainty.
Yeah.
And this
And we're seeing that.
is creating the uncertainty.
Yeah.
Exactly.
Yeah.
Exactly. So, no.
The short answer is no.
Yes. Exactly.
So what can people do? You know, this is certainly an advocacy moment, and we've seen, again, the votes on the bills, both in the House and the Senate, be delayed because of the actions of individuals, people who vote, and those who may not be ready to vote yet. So what in this moment that seems so helpless, what can we do?
Definitely. My heart has been so warmed over, what is it now, 6-8 months.
God.
This conversation's been going on for a while, definitely. But my heart has been warmed to see all of these people coming together and starting a conversation, asking maybe myself, asking other people, and trying to get informed. And as part of doing that, a lot of people within the healthcare community have gotten together to create an organization or coalition called Protect Our Care, Illinois.
Website.
And there's the website.
Magic.
So Protect Our Care Illinois is a statewide coalition of healthcare advocates, providers, consumers, and workers joining together to prevent the repeal of the Affordable Care Act and prevent disastrous changes to Medicaid, protect and expand access to quality, affordable care. So you can go on this website, protectourcareil.org, and navigate through it, see who's a part of the coalition, and look at different resources.
Okay,
That's an important
click on
thing.
the resources page here.
So we have had amazing champions like our Senator Dick Durbin, who had been very active within the community and worked with our coalition a lot of times. You can see some of his videos, you can look at some of our resources, Medicaid, children care, protect our care materials, all of these things to really educate yourself.
Yeah.
Now, I want to keep in mind that this is a nonpartisan coalition. And I want to emphasize that the information you are receiving through this is not through a lens of a news organization with an opinion piece to it. These are fact-based. We have some data linked at the bottom, and I hope you can feel comfortable when you navigate through this. And you can see some of my handiwork in here. And a lot of the work and amazing work from the coalition. There's been great partners to this. But you can also take action. And you can call your Congress member. We keep talking about drain the swamps and these DC insiders. You too can be a DC insider. And you can use this number right on here and save this in your phone. I know you all keep it on you at all times. And you can call this number on your way to work at the end of the day or over the lunch. You can call as many times as you want in the day. And those staffers will log all of this information. And if you're nervous about what do I say, I'm not quite sure, we've created a script and we've really broken it down to how to highlight things. So you are empowered. But don't have to just use Protect Our Care. You can also get involved with many other resources. The AIDS Foundation of Chicago also has a lot of things, and a lot of our partner organizations as well.
Okay, so we went through that whole healthcare thing pretty quickly. There's a lot more.
So much more.
But we didn't want to overwhelm folks. But know that you can get in touch with Elena at the AIDS Foundation of Chicago, and you can also link to information, and we can connect you to AFC and other resources through Pride Action Tank, prideactiontank.org. We're a project of the AIDS Foundation of Chicago. Again, our focus is on LGBTQ issues, but it's a great partnership, and we have access to wonderful folks like Elena and a whole policy and advocacy team at the AIDS Foundation of Chicago. So there are many ways to get engaged. There will be advocacy days coming up next spring. There will be letter writing campaigns. We do podcasts and webinars, all kinds of ways that folks can get engaged. So don't despair. You do have power. and we're gonna do what we can to make sure that healthcare is an option for everybody who needs it. So, until next month, thank you so much for joining us for Pride Action TV, and we hope you have a great month and enjoy the summer.
Bye.